Top 11 Most Common Weird Chest Sensations Causes. Created by UPOlife. Have you ever felt weird sensations in the chest, but couldn't quite tell what was wrong? All that unfamiliar pounding and fluttering can be a little shocking. In many cases, the palpitations are not a cause for concern. They could be the result of a heavy workout, consuming too much alcohol, caffeine, or nicotine. But, in other cases, the symptoms could be linked to more serious issues, and with a person with already existing heart disease, the warm feeling in the chest could be a sign of trouble. Here are the 11 chest sensations you should watch out for. 1. Centered stabbing, pressuring, and debilitating pain. This is a telltale symptom of a heart attack. If the pain is accompanied by a feeling of sickness and makes your body feel frail and weak, you need to contact a hospital immediately. This type of pain is often described as heavy pressure, like if someone is sitting on the chest and constricting the heart. 2. Pain that radiates to the arm. The pain doesn't have to be solely focused on the heart. It can also spread all the way to the arm. This is what we call radiating pain. In fact, in some patients, it can start to affect the entire left region of the body. This is a classic sign of a heart attack and a serious red flag. 3. Discomfort and tightness. If there is a blockage in the heart artery, it will result in discomfort and tightness. This could be a clear indicator of a heart problem. Every person can develop a different feeling. For some, the discomfort turns into pinching, while for others, it becomes a burning sensation. 4. Irregular heartbeat rhythm. The normal heart rate should range from 60 to 100 beats a minute. If the rate is higher or lower than that, it means that the heart is beating off course. That's when the cardiovascular electric system misfires and causes a lack of breath, dizziness, and a bubbling feeling in the chest. Sensations such as these could be an indicator of atrial fibrillation. 5. The discomfort that spreads to the shoulders, back, and abdomen. If an organ is inflamed, it will send radiating pain across the body. In case that inflammation is the result of gallbladder inflammation, the pressure can be felt in the chest and transferred all across the body. To treat the condition, doctors can prescribe pain meds and antibiotics. 6. Gurgling feeling in the chest. Indigestion can cause a range of problems for the body, including acid reflux, nausea, and bloating. In many patients, it can also result in a gurgling sensation in the chest cavity. The problem is treated with healthy food choices that can rejuvenate and calm the stomach lining. 7. Pain when taking a breath. When the chest nerves get agitated or squeezed, the body experiences a precordial catch syndrome. While it is not a reason to worry, it makes breathing tricky, since every time you take a breath, you will feel a pain in the chest. The pain is sudden and disappears on its own after a week or two. 8. Sharp pain in the chest cavity. The pain in the chest doesn't always have to be a sign of a heart attack. It could also indicate leaks or damage to the lungs. If the pressure in the chest cavity turns to sharp pains, it might show that a patient has a collapsed lung. 9. Aches associated with cough, chills, and fever. Bronchitis is a serious inflammation of the air tubes responsible for supplying the lungs with oxygen. If the tubes are inflamed or damaged in any way, people start to experience pressuring pain in the chest. A doctor can diagnose the condition and prescribe proper medications for adequate treatment. 10. Inflammation in the chest cavity. In case of an injury, like a rib fracture, the thin membrane surrounding the chest cavity can get damaged. The impact can result in unusual chest sensations, like pain and tension. This is what experts refer to as pleurisy, and can be treated with adequate antibiotics. 11. Chest flare-ups with blocked airways. Asthma is a common trigger for bubbling chest pain. It's a condition that blocks the airways and makes breathing incredibly difficult. The compression of the lungs contributes to the pain and aggravates the flare-ups. However, the condition can be managed with adequate medication. Learn more about how to evaluate your heart health and manage your heart condition at home by visiting UPOlife.com.